बिस्मिल्लाहिर्रहमानिर्रहीम। शुरू करते हैं अल्लाह के पाक नाम से जो बड़ा मेहरबान निहायत रहम करने वाला है। खबर वाला के साथ मैं हूँ हसीब अरसलान। ये एक प्रोग्राम्स का सिलसिला जो मैंने और गौहर भाई ने आज से 3-4 हफ्ते पहले शुरू किया। मुख्तलिफ टॉपिक्स के ऊपर बात जब करनी शुरू की तो आप सब लोगों की तरफ से बड़ा उसको अप्रिशिएट किया गया और बड़ा अच्छा फीडबैक आया, तो हमने सोचा कि उस सिलसिले को जारी रखें। आज के प्रोग्राम की खास बात यह है कि देखें, जब से ये शुरू हुआ है नेगेटिविटी है हर तरफ मसाइल के ऊपर बात हो रही है, इश्यूज क्या पैदा हो रहे हैं, लेकिन इन्हीं मसाइल के अंदर से कुछ पॉजिटिव चीज़ें जो हैं वो भी सामने आ रही हैं। और मैंने और गौर भाई ने ये सोचा है कि हम कोशिश करेंगे कि जहां मसाइल पे बात करें वहां उन पॉजिटिव चीज़ों को जो है वो भी सामने लाएं। लेट मी ऐड गौर भाई। अस्सलाम वालेकुम गौर भाई, कैसे हैं आप?
अस्सलाम वालेकुम, कैसे हैं हसीब भाई, आप खैरियत से?
अल्हम्दुलिल्लाह बिल्कुल ठीक ठाक। आपके फैक्ट्स एंड फिगर्स जो हैं वो बड़े लोगों को पसंद करते हैं उसको, और आप आज हम आपसे उनका सोर्स भी पूछेंगे, लेकिन आज के प्रोग्राम से हवाले से थोड़ा सा आप इंट्रो दे दें एंड फिर हम अपने जो गेस्ट हैं उनको भी इंट्रोड्यूस करवाते हैं।
जी, आज का प्रोग्राम इट्स अ बिट ऑफ गुड न्यूज़। ऑब्वियसली देयर इज अ लॉट ऑफ डूम एंड ग्लूम। कोविड-19 के बाद ऑब्वियसली पूरी दुनिया बहुत अप्रीहेंसिव है और काफी परेशान है कि किस तरीके से दुनिया में सारे मामला चल रहे हैं। पूरी दुनिया इस वक्त इस बीमारी की लपेट में है, लेकिन जहां बहुत ज्यादा बुरी खबरें हैं वहां कुछ अच्छी खबरें भी हैं। और हमें चाहिए कि हम सिर्फ हर वक्त बुरी खबरों के ऊपर कॉन्सेंट्रेट न करें, बल्कि कुछ जो पॉजिटिव न्यूज है उसके हवाले से भी बात करें। तो एक दो फैक्ट्स एंड फिगर्स मैं आपको थोड़े से बाद में क्विकली बताऊंगा कि क्या सिचुएशन है, क्योंकि एक तो ये भी कहा जा रहा है कि हमारे जो एथनिक माइनॉरिटीज के लोग हैं वो 3 times मोर जो है ब्लैक अफ्रो कैरिबियंस और एथनिक माइनॉरिटीज के खास तौर पे एशियंस में पाकिस्तानी, बांग्लादेशी नंबर 1, पाकिस्तानी नंबर 2 और इंडियन नंबर 3, they are 3 times more likely to suffer from serious illness due to COVID-19 compared to the other counterparts living in the UK. So ये इसके कुछ उस पे कंस्पिरेसी थ्योरीज भी हैं, कुछ और भी हैं, लेकिन फैक्ट्स, वो कहते हैं ना कि फैक्ट्स एंड फिगर्स जो हैं वो इम्पोर्टेंट होते हैं। लेकिन आज जो सबसे पॉजिटिव न्यूज है हसीब भाई, आपके इस प्रोग्रामों के सिलसिले में मैं समझता हूँ कि दिस इज वन ऑफ द बेस्ट प्रोग्राम्स इंशाल्लाह, क्योंकि आज हमारे पास एक ऐसी स्टोरी भी मौजूद है, ऐसे फर्स्ट हैंड एक्सपीरियंस मौजूद है जो मेरे भाई हैं छोटे, जो बहुत सीरियसली जिनको ये इशू हुआ कोविड-19 का। His name is Taimur, and Councillor Taimur is actually, Taimur Tariq is not only cabinet member for Barry Council, but also he's deputy leader, first deputy leader for Barry Council as well. So, Taimur Tariq bhai, assalamu alaikum.
Wa alaikum salam, Gohar bhai and Haseeb bhai. Thank you for having me on.
So, in Samia, we will be asking him, inshallah, today, what exactly, take us through the events on the day, what happened, and obviously you became really serious. How you recovered, what were the symptoms, how you felt, and how you stayed strong. So please take us through your very brave journey that you went through. Thank you.
Yeah, thank you for that introduction. Firstly, I think it's important for me to be honest and to say that before the events of that day when I got taken into hospital, if I'm being honest with myself, there were 1 or 2 symptoms that I was feeling for a couple of days. Now, wrongly, I decided to ignore them. I carried on doing what I was doing. So because of my leadership role in the council, I was very much involved with all of our plans with COVID, around the schools, around the council services, around, for example, Muslim burials, around the closures of our masjids. I was extensively involved. I was going from one meeting to another. I was on emails, phone calls. There were lots of things going on. And just within me, I felt like, yeah, there's 1 or 2 things that I'm feeling. For example, I felt a sore throat. I felt the temperature for a couple of days. I felt aches and pains in my body. I was shivering. Those were the early signs, and I just decided to take some tablets and just to ignore it. Because I just saw COVID-19 as one of those distant things. It had just started to spread in the country. It was just becoming talked about. There was no social distancing. There was no lockdown. It was kind of like a new thing amongst society, and I just thought, well, I can't have that. So on that night, it was a Wednesday night, I can't remember the date off of my head, we had a full council meeting, which was an emergency meeting called for half an hour. I went along there, and even when I left the house to go there, I wasn't feeling 100%. I obviously didn't share with any of my colleagues how I was feeling, because it would raise alarm bells and they would say, "What are you doing here?" etc. I just thought, I need to get through this meeting. I need to take part in the vote, and that'll be that. But when I got home, when I got out the car, that's when I started to feel worse.
So what were the initial symptoms, Taimur, if you don't mind disclosing them?
Yeah. So the symptoms were a very high temperature. So my temperature was at 40. I had a sore throat. I had abdominal pain, which is also a symptom of COVID. And I was just lacking in strength and energy. And that's when I got home, and that's when I collapsed. I got managed to get into my bed eventually. From that point on, I just felt physically just totally out of it. I was vomiting very, very heavily, which is a clear sign of COVID as well. Okay. I was shivering, I was sweating, like I say, uncontrollably, to the point where it started to affect my speech, where I wasn't able to speak fluently. I wasn't getting my voice became very faint. And my wife and my mum were supporting me, and very quickly they both became very concerned and upset as to what was happening, because I deteriorated very, very quickly. They phoned 111 to get advice. Then they said to ring 999. I was put through, or my wife was put through to a clinician. The clinician, I only realized this a couple of days afterwards, but the clinician stayed on the phone for the 40 minutes until the ambulance arrived, which is quite unheard of, really, because usually they kind of assess you on the phone and they say just wait for an ambulance. The paramedics arrived. Again, I was checked over. The paramedics said straight away I have to go to hospital, and at that point I really felt the worst, because as I was in my bed, as the paramedics arrived, I was unconscious and they woke me up. But when I woke up, alhamdulillah, to the sound of Surah Rahman. Now, that's what my mum and my wife had put beside my bedside. And that, because I couldn't say much, but that really got me thinking that, often when you're in a critical place or position, and your health is affected, most of us hear that, different surahs are read out when you're in a critical state. And I remember saying to my wife when the paramedics came, saying, "I can't fight this. I'm feeling worse and worse." So the paramedics took me, went to hospital, and I was checked over by 3 different consultants, and it was a very, very challenging experience.
The moment you realize that something's not right here and I need to either ring hospital or go to hospital, starting from that moment to the moment you got into the hospital, how long was that time duration?
So I got home about I'd say about 8 o'clock. And I think by the time we didn't ring 111 straight away, because we weren't really sure what was happening.
The moment you got into the hospital, how long was that time span?
I'd say about tops couple of hours.
Also, it was that quick that within calling them and them assessing you, sending the ambulance, within a couple of hours you were in hospital and already.
Yeah, like I say, we were surprised that the ambulance came within 40 minutes, which was, if you look at the national stories that were coming out, you were lucky to get an ambulance in 2-3 hours.
Especially on such a hard time, because on a normal day it's different. You get ambulance within a few minutes, but at such a time when the whole country is fighting the COVID-19 and everything's understaffed, there's lack of ambulance services, lack of people, lack of actual vehicles. So alhamdulillah, we're glad, and maybe that's one of the reasons that you are sitting here between us today.
Yeah, alhamdulillah. I can't fault the health professionals. They saw to me straight away. Like I say, even in the hospital, I felt out of it. I didn't have energy to speak. I couldn't stay awake. most of the time I didn't know what was happening, and they were waking me up every time a different consultant was coming in to see me. But I can't fault them at all. I feel very, very fortunate that the paramedics acted quickly, the 111 service acted quickly. The fact that the clinician, like I say, she stayed on the phone all that time when the demand for the NHS is at all-time high. The phone calls, it's hard to even get through on the phones. So I just felt really, really lucky, and I'm just grateful to all the health professionals that saw to me, that supported me. I was put on drips immediately. They just addressed all the problems that they were with me quite quickly. Now, unfortunately, I had to go back in after 7 days because my abdominal pain was carrying on, and it went into my back. And actually, that is another sign of COVID. Excuse me. I didn't know this, but abdominal pain that goes into your back is also one of the signs of COVID. Again, because I'd already been in hospital, because they already had my records, they asked me to come in straight away. This time they said that, look, if you really need an ambulance, we'll send it you. But I went down there with my wife. I got seen to, again, I was assessed. And after a few hours, I came out. I was given some pain relief. So it's now been, I think, 5 weeks. Only last couple of days I've started going out and about. Even now, my legs are I've got a lot of aches and pains, which is also some of the after effects of the virus. So some people, for example, you can have the symptoms and they clear up within a week or two. My symptoms, alhamdulillah, have cleared up, but I'm still living with some after effects of the virus because my body was so physically drained. I cannot begin to explain. Even going up the stairs became a challenge for me. But alhamdulillah, I feel when I've heard about other unfortunate stories, of course, I'm thankful to the Almighty that I'm still here. And that alhamdulillah, I've seen through the worst of it. But yeah, this is a very difficult time. Unfortunately, there are some sad stories around this issue. But, alhamdulillah, there are many people like me who've also come through the worst, who've been supported by incredible friends and family, and are now trying to, rebuild themselves physically and ensure that they're on a good road to recovery and inshallah, good health.
Taimur, what would be your message to people, obviously, who are healthy at the moment?
I can't hear you.
Can you hear me now? Can you hear me, Taimur?
Sorry, there's no sound. I can't.
Okay, can you hear me now?
क्योंकि उनको बीच में कोई कॉल आई थी जिसकी इंटरप्शन की वजह से उनको हमारी आवाज जो है वो नहीं जा पा रही. बड़ी एक पॉजिटिव चीज भी है, लेकिन जब उसको आप सुनते हैं, सोचते हैं और महसूस करते हैं तो बड़ा एक दिल को चुभने वाली और दिल को लगने वाली जो है वो बातें हैं कि कैसे एक इंसान हशाश बशाश इंसान, एक काम करता हुआ इंसान, लेकिन वो लोगों की हेल्प करने की कोशिश कर रहे थे. काउंसिल के डिफरेंट पैनल्स पे उन्होंने बताया कि मैं काम कर रहा था मुस्लिम बेरियल पे. एक वो इंसान जो इस सब मामले की अवेयरनेस रखता है, उसके बावजूद वो इसका शिकार हो जाता है. गौर भाई, आप क्या कहेंगे इस पे?
जी, असल में तैमूर भाई बड़े एक्टिव माशाल्लाह नौजवान है, एंड ही इज वन ऑफ द यंगेस्ट काउंसलर्स माशाल्लाह इन द यूके हमारी कम्युनिटी से, और अच्छे तरीके से रिप्रेजेंट. सो इफ यू कैन रीजॉइन अगेन दैट वुड बी गुड. तो इनका ये बड़े मुतहरिक हमारे छोटे भाई हैं. जो बात ये है हसीब भाई के, ये जो बीमारी है ना, ये इस वक्त ये नहीं देख रही कि आप एक्टिव हैं, आप एक्टिव नहीं हैं, आप क्या कर रहे हैं, क्या नहीं कर रहे. जब आपको इन्फेक्शन हो जाता है ना, और बड़ा क्वाइटली वो आपके अंदर रहता है, ये जो जरासीम है, जो ही वो आपको अटैक करते हैं टू द पॉइंट के ही मतलब तैमूर कोलैप्स्ड, ही एक्चुअली कोलैप्स्ड, और फिर उसको हॉस्पिटल में लेके जाना पड़ा. और जिस बहादुरी से इसने मुकाबला किया है इस वायरस का, इस बीमारी का, अल्लाह ताला ने उसको शफा भी दी है. लेकिन आप देख सकते हैं कि अभी भी उसको असरात, he can still feel the aftermath, is still feeling
some of the symptoms which were not made very common, like you just mentioned, abdominal pain, up to now, I wasn't aware that within coronavirus you get abdominal pain. So that's something new which I've just heard. So I think these are the things which people still need to be told and need to be taught about. And Taimur, we were talking about you. So I think one of the biggest aftershocks or the after effects after even recovering from this COVID-19 is the weakness which I think you get, which we can still see and feel. But alhamdulillah, you're still strong enough to fight with it. So we were saying, what message would you like to give to people? Because most of them they are listening to the government's advice, but what as an affected person, what would you say to people who took it a bit on a lighter note and who are not reacting on it properly?
I would just say, look, I was honest with you at the beginning, and I said that my own weakness is that I didn't acknowledge some of the symptoms, and I just carried on and just kind of ignored it, and it got to a point where on that particular night, I deteriorated very quickly. That's why this is an important message to everyone, that don't take anything lightly. Protect yourselves, protect your loved ones, your friends and family. Especially us youngsters, we can pass it on to the elderly very, very quickly. And the important point you're talking there, Haseeb, about knowing things about this virus. One of the things I didn't know from a couple of weeks ago was that for a person who doesn't present any symptoms or hasn't been ill with the virus, they can still pass on the germs to an elderly person. And that person who passes it on may never get any symptoms, they may never get ill, but they can pass on the germs. So this is another misconception, that actually it's not just people who have got COVID who will pass it on. It can be passed on by anybody, and the person who passes it on will not always become ill. That's an important message. This is why social distancing and all the stay-at-home messages have become more and more prominent by the government and the NHS, is because unknowingly you could be passing it on without knowing you've got it yourself. Because a lot of people that have been tested for it, they've got what you call mild symptoms. Well, mild symptoms, it doesn't really affect you. You can't really pick it up. And they only know that because they were lucky enough to be tested. So you can imagine how many people might be out there with mild symptoms that are unknowingly passing it on. Excuse me. So it's important that we take these messages really, really seriously. One of the things I said to my friends and family a couple of days after this happened, that I would never want it to happen even to my worst enemy. Because when I came home from hospital and I was recovering, those first 7 days were hell. Because I was I was in my own room, I was isolated. I didn't feel like eating and drinking anyway, but that lack of energy, just constantly lying down, excessive sleeping, it could really, really take a toll on a person. And was obviously though I was lucky to be surrounded by lots of friends and family who were making contact with me on the phone, it's obviously not the same as being around people. So it's just being conscious of that it can really floor you as a person. It can hit you really, really hard, like it did with me. And alhamdulillah, there are good cases where people come through. There are unfortunate circumstances where some people are no longer with us and people are losing loved ones. So it's really, really important that we take this seriously. Now, this is, I would say, a different world to when I first got the symptoms on that night. Because, like I said, there was no lockdown, there was no social distancing. All of that has happened now. So I think we've got no choice but to acknowledge this, to accept that it's really serious. But I think we all still have a personal responsibility to ensure that we're doing everything in our power to protect one another. This is a very, very serious virus. It's a very serious illness. And we need to do all we can to help one another.
Taimur bhai, just a quick one there. I mean, thank you for going in detail and letting us know, how you went through the whole ordeal, if you like. What would be your advice to people? First of all, what really kept you going? Secondly, did you actually, within your family, how did they cope with the whole thing? And secondly, were they infected by it as well? Because, obviously, if you had it, then they have got a really good chance of getting it, you say. So how did you prevent it, and how did you actually manage to make sure that least damage was done in terms of spreading it? Because obviously once you had it, you knew you had it.
Yeah, so I was lucky in the sense that a number of days, quite a lot of number of days before I fell ill that night, I actually was not at home that much. Because of all the meetings, because of some deaths in the local community, I was coming home quite late night and I was going straight into my bedroom. And then obviously the working day would start. There was lots of pressure on me. So I was really not around my family much. But what happened was, before I came out of hospital, I lived with my wife and my parents. My parents had already moved out, and my wife, stayed with me to support me, though she was isolated as well. And thankfully, none of my parents got any of the symptoms. I had less contact with my father as well because he runs his own business. So we weren't, it's a takeaway. So we weren't really seeing each other at the same time, apart from, a quick couple of minutes here and there if we're lucky. And my wife has been ill in between while she was supporting me. um, but it wasn't serious enough to get any hospital assistance. So we're not sure if she
She
had
had
COVID, but she certainly had symptoms. So
really
that's,
mild one, like you said, that it was
yeah, possibly.
Well, you've been there, done it and got the T-shirt as well, as they say.
Yeah.
What would you say to people? I mean, what would be your message to the people who actually think in all sorts of conspiracy theories and say, well, I don't have any underlying health issues. What would be your message to that? And also, what really kept you going within this period as well while you were
And
actually in the
also,
hospital?
I'll add one more thing to it, Taimur bhai, that look, there is another theory, or shall I say, a false information going around to people as well, that whoever goes to the hospital never makes it back. You are the prime example in this process. That's why, especially when you talk about Asian community, that's why some of the people who even have the symptoms are a bit reluctant about this. That we don't want to go to hospital even if we have some strong symptoms. So what's your message to them? Because you've been there, you've
Yeah.
seen it, you fought with it, and alhamdulillah, you have recovered. What would you say?
Yeah. My message is very clear that, look, don't take this lightly. It is quite a serious virus. That can have implications for yourself and your loved ones. And, yes, there is risk with going to hospital. But ultimately, if you need hospital treatment, that's the only way you're going to get yourself out of this situation. And unfortunately, for example, with me, if I kept thinking that I can't go to the hospital, that I'm worried about what may happen, then it would have had other implications on myself, whether I would be in front of you today or not. So, yes, of course, you know what? There's always risk in going into hospitals, whether there is a coronavirus, whether there's a lockdown. There's risks all the time. There always has been, but it's only now we're actually taking it seriously. So if health experts feel that you need hospital treatment, I would urge everyone to seek that hospital treatment. And ultimately, Allah knows best. It's all written for us. What's going to happen? And for those people who are not taking it seriously, like I said before, I'd urge you to do so, because having been through it, I'm quite clear in saying that it's an awful, awful experience. And what kept me going was my friends, my family, my associates making contact with me, asking after me, checking on me. Obviously, from a mental health point of view, that is important as well, because being on your own in a room, it's not a pleasant experience. But knowing that there are people out there doing dua, people who are giving me support, are people dropping off, sometimes fruit, juice, drinks, just having that sense of people are around me, even if they're not physically, that is what kept me going. So, I just give those clear messages that please follow the advice. If you feel you've got any symptoms, don't do what I did and ignore it, first of all. Try and get the best help that you can and just protect one another. Because without doing that, we're not going to come out of the situation anytime soon. And if people are still going through it, people are still ill, of course, I will remember them in the du'as and I send my best wishes. But I cannot stress enough how important it is that you take this seriously and that you try and spread this amongst your contacts and your friends and family. Spread the message as to how important it is to support one another and help one another through this pandemic of coronavirus. And inshallah, when we do come through this as a country, as a society, as a global community, we'll come through it a lot stronger, understanding valuing the health service, valuing care workers, valuing the key workers that we have in our country, and just not taking your own health or your life for granted at all.
And Taimur, just relevant to what you just said, in terms of, because you've been to the hospital, you got the treatment and everything. How satisfied are you with regards to the government, testing policy and all that? And also, according to Institute for Fiscal Studies, IFS today, it was a report published today. They're saying that people from the ethnic minority background, and especially from Afro-Caribbean background and Bangladeshi, Pakistani, and Indian background, are actually 3 times more likely, to fall victim serious illness to the coronavirus. What would be your message, and also in terms of where you are, because you've got a responsible role? What are your comments with regards to government? Are they doing enough in terms of testing? Are they, can they do better? How can things be improved?
Yeah, so I think in terms of testing, let's be honest, I think the government were a bit slow off the mark around understanding the seriousness of testing, giving our key workers that trust and confidence that actually when they're going into work every single day, we're giving them, for example, the adequate PPE, but also we're giving them adequate testing, because these people, yes, they are supporting our most vulnerable who are falling ill, but they're also going back to families, back into their homes, and the sacrifice that they have to make. I know many health professionals who have said that they've had to completely either move out or ask their families to move out of where they are living because of the uncertainty around testing. Now, we've seen some improvements on that, and I hope it's not too little too late in addressing some of the challenges around testing. And I have to say that the UK government were a bit slow off the mark compared to other European governments and other governments around the world. Testing should have been the absolute first priority from when this pandemic hit the UK. I do think that we're a bit slow off the mark as a country as well, that the signs were quite clear from December and January. I don't think adequate planning was done. I don't think adequate messaging was given out to the population. And so, that could have been a key sort of avenue for prevention if we'd communicated the messages, if things would have been in place before cases have started to rise. And it's an unfortunate chain of events where we've got over 25,000 deaths due to coronavirus. Only in recent days, for example, have the government decided to share the details of those deaths in our care homes, care and residential homes. That for me is not good enough. Our most vulnerable people live in those homes, and of course the staff have now become very vulnerable as well. So there have been some weaknesses on the government's part. I'm not trying to make this a party political issue. I do think in such an emergency situation and the biggest public health crisis this country has ever seen, we should all work together constructively. But I think it's also appropriate to provide a challenge as well where it's needed. Forgive me, I've forgotten the second avenue of your question.
Yeah, the second part of my question was in terms of you explained, in terms of the government and what they're doing. What can they do, and what can us as a community do in terms of
about the BME population?
Sure, about the BME to make sure that we are very disproportionately represented in terms of falling victims to this.
Yeah,
what's the reason behind that, and how is it like in your area?
Yeah, I want to commend some of our politicians and some of our health experts that were talking about the disproportionate impact on the BME community long before certain reports were published, because this has been a pressing issue. And you might ask why so, and that's because of the lifestyle of the BME community. So we have extended family and friends, we have a large circle, we are more of a cohesive community. That is why our friends and family and people amongst the BME community have fallen victim to this virus, because, to be put bluntly, because of our contact rate, because we mix more. And I think it's taken some weeks for this to be acknowledged. And maybe when the figures did back this up, it perhaps was a little bit too late because of the significant number of cases had already increased. But those are even more greater reasons to be vigilant as members of the BME community, that actually we are more prone to this virus than other communities. And for example, we live in extended families. So when I talked about earlier about the risk of youngsters passing this on to grandparents, this is a greater risk within the BME community because of our. It's important to acknowledge that and just to appreciate what risk the BME community is under and has been under, and it's important that we address that as well.
Thank you, Taimur. मैं समझता हूँ कि तैमूर ने बड़ी informative चीजें
Sorry, the sound has gone again.
I think the same issue has happened, but हमें जितनी information तैमूर से लेनी थी, I think वो we've gathered, and उनके इतने कीमती बातें हैं, क्योंकि एक आम community member नहीं है, बल्कि एक काउंसलर भी हैं और बहुत सारे डिफरेंट पैनल्स के मेंबर भी हैं. उन्होंने बताया कि जब वो इससे अफेक्टेड हुए तो उस वक्त वो खुद लोगों की मदद कर रहे थे, डिफरेंट पैनल्स पे, डिफरेंट कमिटीज में काम कर रहे थे, बल्कि काम से वापस आके एकदम उनको अचानक हुआ. गौर भाई, हमारे पास दूसरा एक बड़ा इंपॉर्टेंट आज जो है वो टॉपिक था, जो आप बड़े दिलचस्प फैक्ट्स एंड फिगर्स जो है लेके आते हैं और हमारे व्यूअर्स उसको बड़ा पसंद करते हैं. हम आज उसको दूसरे सेक्शन में, प्रोग्राम के हिस्से में करेंगे, जिसका इंट्रोडक्शन में भी आपने बताया था कि आप बड़े इंटरेस्टिंग से फिगर्स लेके आए हैं कि हमारी जो माइनॉरिटी कम्युनिटीज हैं वो इससे ज्यादा अफेक्ट क्यों, 2.5% ज्यादा अफेक्ट हो रही हैं बाकी कम्युनिटी से, या यहाँ की जो दीगर कम्युनिटीज हैं उससे. उसकी वजह क्या है, उसकी कॉज क्या है, उसको प्रिवेंट किस तरह किया जा सकता है और फ्यूचर में हमें उन चीज़ों से किस तरह बचना है, ये इन सब चीज़ों पे हम अपने प्रोग्राम के दूसरे हिस्से पे बात करेंगे. गौर भाई, अगर आप इस सारी इन्फॉर्मेशन को भी कंक्लूड कर सकें, सो दैट वी कैन लीव नाउ. एंड जो दूसरे हिस्से का प्रोग्राम आज ही हम शाम को करेंगे, उसमें इंशाल्लाह वो सारे फैक्ट्स एंड फिगर्स जो हैं उसमें वन ऑन वन हम बैठ के बात करेंगे और लोगों के क्वेश्चंस जो हैं उनको भी आंसर करेंगे. लेकिन अभी आप इसको प्लीज काइंडली अगर आप कर सकें.
जी, थैंक यू हसीब भाई. मुझे पता है कि आज आप माशाल्लाह दुनिया टीवी के को भी रिप्रेजेंट करते हैं. आज आपकी एनिवर्सरी भी है, उसके बावजूद आपने 5वीं एनिवर्सरी है.
5 साल हो गए
जी, उसके बावजूद आपने टाइम निकाला, सो ये आपका बड़ा शुक्रिया. मैं सिर्फ यही कहना चाहूंगा कि क्विकली, एक तो खोकर साहब का कमेंट है, उसका जवाब मेरा ये है कि बिल्कुल जब इस वायरस की वैक्सीन आ जाएगी तो बिल्कुल उसका इलाज उस वैक्सीन से मुमकिन होगा, लेकिन उस वैक्सीन को मार्केट में आते आते 6 से 9 महीने और कम से कम लग सकते हैं. सो ये ना समझे कि सितंबर अक्टूबर से पहले कोई वैक्सीन आ जाएगी. सो वैक्सीन अगर आ भी गई, उसके टेस्ट एंड ट्रायल्स के बाद वो सितंबर और अक्टूबर के बाद ही आएगी और फिर उसको रोल आउट करना वगैरह. बट क्विकली जाने से पहले मैं सिर्फ ये कहूंगा, और इंशाल्लाह इसको दूसरे हिस्से में बड़ी सैर हासिल इस पे गुफ्तगू करेंगे और बड़ी फायदेमंद होगी लोगों के लिए कि किस तरीके से हम हेल्दी रह सकते हैं. लेकिन हमें कुछ रिव्यू करने होंगे बड़े क्विकली, और वो ये है कि फर्स्ट ऑफ ऑल हमें अपनी लाइफस्टाइल में चेंजेस लाना होगा. कोविड-19 से ज्यादातर इफेक्ट होने वाले लोग वो है जो सेहतमंद है लेकिन बुजुर्ग है, लेकिन उनकी जो खुराक है वो ठीक नहीं है. ऐसे लोगों को भी इफेक्ट कर रही है. सो फर्स्ट जो इसका एलिमेंट है वो ये है कि जो 60 एंड अबव है वो ज्यादा लाइकली है उनके ऊपर इसका जो असर है कंपेयर टू दूसरी एजेस. नंबर 2 बात ये है कि आपको सुनकर ये हैरानी होगी कि हमारे लोग क्यों 2.5 टाइम्स ज्यादा, बल्कि 3 टाइम्स ज्यादा वो है इंस्टीट्यूट ऑफ फिजिकल स्टडीज के मुताबिक इसके विक्टिम्स. उसकी वजह ये है कि हमारी डाइट बहुत पुअर है. कहते हैं कि डेप्रिवेशन इज मदर ऑफ ऑल इविल्स. ठीक है ना. हमारी डाइट में हम लोग ना ज्यादा फ्रूट इस्तेमाल करते हैं, ना वेजिटेबल्स इस्तेमाल करते हैं, हम ज्यादा रिच ग़िज़ाएं खाते हैं, और प्लस उसके अलावा ओबेसिटी एक बहुत बड़ा इश्यू है जो आपको मैं बाद में इसके ऊपर गौर करेंगे. डायबिटीज और हार्ट डिजीज और हाई ब्लड प्रेशर भी बहुत बड़ी इश्यू है. तो इंशाल्लाह इसको टच करेंगे बाद में. आपका बहुत बहुत शुक्रिया, आपके सुनने वाला को भी बहुत बहुत शुक्रिया. इंशाल्लाह इसके ऊपर सैर हासिल गुफ्तगू होगी और लोगों को हम फैक्ट्स भी देंगे, फिगर्स भी देंगे, और सिर्फ प्रॉब्लम डिस्कस नहीं करेंगे, इंशाल्लाह सॉल्यूशंस भी देंगे इसके साथ.
इंशाल्लाह आज हम कोशिश करेंगे कि इफ्तारी के बाद जब सब लोग खा पी के और अपना पेट भर के जो है आराम फरमा रहे होते हैं उस टाइम में आए, ताकि लोगों की क्वेश्चन जो है उनको भी आंसर कर सकें और जो फैक्ट्स एंड फिगर्स, इंटरेस्टिंग फैक्ट्स एंड फिगर्स हैं आपके पास, वो भी उनसे शेयर कर सकें. अब तक के लिए
मीनवाइल आपके सुनने वालों को जुमे की पहला जुमा आज रमजान का था, उसकी बहुत बहुत मुबारक हो. रमजानुल मुबारक की भी मुबारक हो, रोजा रखने की भी मुबारक हो. अल्लाह ताला आप लोगों को, हम सबको अपने हिफ्ज़ व अमान में रखे और सेहत से रखे और अपना ख्याल रखें. और
बहुत शुक्रिया गौर भाई. थैंक यू. खुदा हाफिज़.
थैंक यू.